Good morning, everyone. The topic for my paper presentation is Profile of Strabismus in Thyroid Eye Disease. So thyroid eye disease, we know that it's the most common cause of extraocular muscle enlargement. And here it's autoantibodies, they are directed against the thyroid receptors, which causes the activation of the orbital fibroblast. And this is most commonly seen associated with hypothyroidism, but can also be seen associated with hypo and euthyroid status. As we all know that inferior rectus is the most common muscle affected, followed by medial rectus, and females, they are most commonly affected in more than males, but when males are affected, they tend to have a more severe form of disease. And strabismus in thyroid eye disease, it's due to the inflammation and subsequent fibrosis of extraocular muscles. And smoking is a major risk factor in thyroid eye disease. So CT and MRI orbit, they helps to look for the enlargement of the extraocular muscle bellies. And here we can see that there is enlargement of the extraocular muscle bellies with sparing of the tendon known as the Coca-Cola sign. And MRI orbit, they also help to evaluate the orbital fat expansion. So in the treatment, we have the non-surgical and the surgical modality. Non-surgical, we have the prisms, the botulinum toxin injection, monocular occlusion, and literature says that around 0.6 to 20% of patients will require strabismus surgery. So the aim of a study was to analyze the profile of strabismus in patients with thyroid eye disease attending a tertiary eye care center who presented with squint or diplopia. And ours is a retrospective study with 28 patients with thyroid eye disease with complaints of squint or diplopia from Jan 2018 to Jan 2023, and patients with other causes of strabismus were excluded. And the data we collected were demographic data, the presenting complaints, complete ocular examination, thyroid status, imaging, systemic diseases the patient had, and the treatment. So out of 28 patients with thyroid eye disease, the age group in our study was from 33 to 88 years, and the most common age group affected was 40 to 60 years, and the mean duration of presentation was approximately 26 months, and in our study, the males were more than the females. And hypothyroidism was the most common thyroid status seen associated in our study, followed by hypothyroidism and euthyroid status. And the vertical squint was the most common type of squint, followed by horizontal. And inferior rectus was the most common muscle affected, followed by medial rectus. And in our study, 24% of the patients had associated lid signs and 36 had proptosis. But we could not do a thyroid antibody test in everyone. Around 25 to 28% patient underwent the antibody test. In that, 29% showed positive results. And diabetes and hypertension was the most common systemic association seen in our study. And 60% of the patients were prescribed prisms, and eventually 8% patient required surgery. So this is one of our patients, a 63-year-old gentleman who was diagnosed with thyroid eye disease, who presented with diplopia, and this patient had left eye hypotropia and also mild elevation limitation, and the patient was given Fresnel prisms, and the patient was doing well with the prisms. This is yet another patient, a 77-year-old with thyroid eye disease, and this patient presented, he had left eye hypertropia and exotropia, and there was also adduction and depression limitation. The patient was not accepting prisms. Eventually, he underwent surgery. Superior rectus recession and lateral rectus recession was done, and on post-op evaluation, the exotropia and the depression limitation was very well corrected, but the patient had only minimal left hypertropia, and the patient is doing well and is under follow-up. And we compared our study with other studies, and most of the studies, the females were more commonly affected, but one of the studies by Millen Naik et al., just like in our study, the males outnumbered the females, and the most common association seen was hypothyroidism. The limitation of a study is the retrospective nature of the study and the small sample size. So the conclusion in our study, vertical restricted squint was the most common, with inferior rectus the most commonly muscle affected. And what different we found in our study was that males outnumbered the females. These are my references. Thank you.
Thank you. Good presentation. Why do you think males outnumber females in your study?
One reason could be ours is the tertiary eye care center, and also the mean duration of presentation which we saw was 26 months. So probably when they had the intractable symptoms of diplopia and strabismus, they would have presented to our center, and some we had a referred cases. So that could be the reason males were more in our study.
Which are the antibodies you have done in your study?
Thyroid, TSH receptor antibodies and TPO antibodies, but probably because of the high cost, we could not do in everyone. So that is one of the limitations. These were the two antibodies we got positivity.
Thank you.